All right, good afternoon, and I apologize for the delay, but we had a lot of stuff come in at the last minute. As a reminder, mute your mics if you want to ask a question, show video and audio so I can see you. I will start off with a statement on the Grand Ethiopian Renaissance Dam. The Secretary General continues to follow closely developments related to the Grand Ethiopian Renaissance Dam. He notes the good progress in negotiations between the Arab Republic of Egypt, the Federal Democratic Republic of Ethiopia, and the Republic of Sudan thus far, and he encourages the three parties to persevere with efforts to peacefully resolve any remaining differences and to achieve a mutually beneficial agreement. The Secretary General underscores the importance of the 2015 Declaration of Principles on the Dam, which emphasizes cooperation based on common understanding, mutual benefit, good faith, win-win, and the principles of international law. The Secretary General encourages progress towards an amicable agreement in accordance with the spirit of these principles. And on another issue, I've been getting a lot of questions this morning about a letter from the Secretary General. And I can confirm to you that the Secretary General has indeed written a letter to the President of the General Assembly about the forthcoming General Assembly session. In the letter, he presents options for member states to consider in order to ensure the holding of the general debate in September. The decision on how to hold the debate lies with member states, and the Secretariat will, of course, support whatever decision is taken by them. This week, the Secretary General is looking at the impact of COVID-19 on the African continent. At a minute after midnight tonight, so on Wednesday morning, he will launch a policy brief that looks at areas of concern, highlights the strengths of the African response, and presents a series of recommendations. We will share with you copies of the embargoed report, as well as the text of the video message that goes along with the report. And on a related note, this year's Africa Dialogue series will begin tomorrow under the theme COVID-19 and Silencing the Guns in Africa, Challenges and Opportunities. The Secretary General will speak at this virtual event, which is being hosted by the Office of the Special Advisor on Africa in collaboration with the African Union and other partners from the UN system. You should be able to watch the event on the webcast, and we will also release the Secretary General's remarks to you under embargo. And this morning, the Secretary General spoke at the virtual meeting of the Economic and Social Council's annual operational activities segment. In his remarks, he said that COVID-19 has exposed our world's fragilities, with the most vulnerable suffering the most. The Secretary General added that the task of eradicating poverty and achieving the Sustainable Development Goals has never been more challenging, more urgent, and more necessary. He went on to tell members of the Council that we now have a triple imperative. First, to respond urgently to help countries stem the impact of the pandemic and suppress the transmission of the virus. Second, to help governments and their people safeguard development gains, mitigate the pandemic's socioeconomic impacts, and protect lives in emergency settings. And third, to work with partners to ensure that the national, regional, and global recovery efforts allow the 2030 Agenda and the Paris Agreement on climate change. His full remarks have been shared with you and are already posted online. The acting special representative for Libya, Stéphane Williams, briefed the Security Council by video this morning on the situation in the country. She made clear that there has been no lull in fighting in Libya. Instead, she reported fighting has escalated with unprecedented increase in indirect fire in urban areas and a growing tide of suffering for civilians. Ms. Williams said that millions of Libyans, most notably the 2 million residents of Tripoli, are experiencing the most abnormal and terrifying experience under almost constant bombardment, frequent water and electricity cuts, all that compounded by restriction of movement as a result of preventive measures around the COVID-19 pandemic. She said that the pandemic compounds existing insecurity in addition to exacerbating long-standing vulnerabilities. The UN system is hard at work, she said, to assist national authorities, including through the provision of supplies, equipment, and training. There are now 5 operational labs in the country, that's up from 2, but many more are needed, including the qualified personnel to operate them. The acting special representative warned that the Council that from what we are witnessing in terms of massive influx of weaponry, equipment, and mercenaries to the two sides, the only conclusion that we can draw is that this war will intensify, broaden, and deepen with devastating consequences for the Libyan people. In the afternoon, the Emergency Relief Coordinator, Mark Lowcock, will brief the Security Council on the situation in Syria. And an update from our peacekeeping missions, which continue to support governments and local communities responding to COVID-19. The UN mission in Abyei, UNISFA, together with women's groups, carried out a COVID-19 awareness-raising campaign aimed at promoting the roles and voices of women leaders in their communities. In support of the Secretary General's appeal for global ceasefire, the Abyei Women's Association, which represents women in the Ngok Dinka community, have called for all armed elements in Abyei to cease fire and focus on efforts on fighting the virus. The UN mission will also distribute solar-powered radios, focusing on supplying them to households headed by women to increase access to information. Meanwhile, the joint UN mission in Darfur is engaging with local authorities and community leaders, including leaders of nomadic and farming groups. It's also distributed hygiene materials in camps for internally displaced people in Zalinge to help them fight the pandemic. And just to flag, a report released today by the World Health Organization on the health behaviors of 11 to 15-year-olds in Europe shows that adolescent mental health well-being declined in many countries between 2014 and 2018. The study compiles extensive data on the physical health, social relationships, and mental health of school children from 45 countries. The report shows that 1 in 4 adolescent reports feeling nervous, irritable, or having difficulties going to sleep at least once a week. And also 1 in 10 adolescents reports having been cyberbullied at least once in the past 2 months. WHO said the report provides a baseline against which future studies can measure the impact of the pandemic on young people's lives. And just to go back to our field work, in terms of UN country teams, I wanted to flag that in Cabo Verde, where there are more than 300 confirmed cases of COVID-19, the resident coordinator, Ana Patricia Grassa, and the government are leading a response and recovery coordination platform. That effort brings together government ministries, civil society organizations, the private sector, and international partners. As part of their call for solidarity, the UN staff in Cabo Verde have donated parts of their salaries to support the government's efforts to address the impacts of the virus pandemic on the local population. And WHO there is also providing medical equipment and technical assistance to health workers, hospitals, and labs. UNICEF and the UN Population Fund are providing tests and are ensuring the continuity of maternal and neonatal health services. The UN team is also boosting job creation with a special focus on youth and women. UNDP and UN Habitat are also supporting local authorities to create temporary jobs in areas including revamping markets, streets, and public works. And the UN team is also boosting innovation and technology solutions through UNDP's Accelerator Lab, encouraging startup and crowdfunding platforms. And an update from Cameroon, where we, and along with our humanitarian partners, are providing health, water, and sanitation, hygiene support, including mobile clinics, disease screening, and virus sensitization to internally displaced people in the northwest and southwest regions of the country. The crisis in these two regions is now entering its 4th year and has led to the displacement of over 450,000 people. To contain the spread of the virus, over 6,300 schools and 4,200 community learning centers have been closed since March in the Northwest and the Southwest. Government and humanitarian partners are providing distance learning to cover half of the children impacted by school closures through radio, TV, and printed material. And turning to Bangladesh, our humanitarian colleagues tell us that the UN and governments are making preparations as super cyclone storm Amphan is set to make landfall tomorrow. More than 14 million people may be impacted by the cyclone in the country. The Humanitarian Coordination Task Team, co-led by the UN and the government of Bangladesh, is working on preparedness and response activities. The Bangladesh Red Crescent Society has also activated its early action protocols for cyclones. It is not predicted that the cyclone will make landfall near Cox's Bazar, but alert mechanisms are in effect, and the UN is working closely with the government on the situation there. Our colleagues at the UN mission in Afghanistan warned today that the rising numbers of civilian casualties in Afghanistan underscore the urgent need for parties to halt the fighting and to refocus on starting intra-Afghan peace negotiations. UNAMA's latest preliminary figures indicate a trend of escalating casualties in April from operations conducted by both the Taliban and the Afghan National Security Forces. There are also grave concern about levels of violence in the first half of May. Since April, in addition to unclaimed attacks on hospitals in Kabul last week, UNAMA has documented the abduction of 15 healthcare workers by the Taliban, as well as a threat to healthcare workers and confiscation of medical supplies by the security forces. UNAMA emphasized that medical personnel and facilities have special protection from attack. Any incident affecting people, places, and supplies necessary for healthcare provision can have serious and wide-ranging consequences, particularly during this pandemic. And on a different register, the UN Global Compact, along with Science-Based Target Initiative and the We Mean Business Coalition, today released a statement in which more than 150 global corporations urge world leaders to work on a net zero recovery from COVID-19. The 155 companies, which have a combined market capitalization of over 2.4 trillion US dollars and represent over 5 million employees, are calling on policies that would build resilience against future shocks by supporting efforts to hold global temperature rise to within 1.5 degrees above pre-industrial levels, in line with reaching net zero emissions well before 2050. The Secretary General welcomed the statement and said that many companies are showing us it is indeed possible and profitable to adopt sustainable emission-reducing plans even during difficult times like this. The statement comes as governments around the world are preparing stimulus packages to help economies recover from the impact of the pandemic and as they prepare to submit enhanced national climate plans under the Paris Agreement. You can find the full list of the companies who signed onto the statement on the Global Compact's website. And the UN Refugee Agency today warned that many displaced indigenous communities in Latin America are now dangerously exposed to or at risk of contacting the COVID-19 virus, with the virus hitting Amazon region hard and Brazil emerging as an epicenter of the pandemic. UNHCR is worried that many indigenous groups may struggle without adequate health and sanitation conditions. A majority of them live in isolated or remote areas where they lack access to healthcare, clean water, and soap. Others lived in cramped dwellings or in informal urban settlements without access to protective equipment. In Brazil, UNHCR is supporting efforts to ensure adequate shelter for indigenous Warao refugees from Venezuela. The agency is also facilitating relocation and providing mosquito nets, hygiene kits, solar lamps, as well as transportation. UNHCR is also continuing hygiene promotion sessions delivered in the Warao and Iñapa languages to indigenous refugees. And in Colombia, UNHCR and its partners are supporting food distribution and providing hygiene kits to most vulnerable among the Yucpa and Wayu populations. Health brigades have also been organized as information and hygiene promotion campaigns tailored for indigenous communities. And ahead of the International Donor Conference for Venezuelan refugees and migrants in Latin America, hosted by the European Union in Spain next Tuesday, UNHCR is calling on countries to pledge support for the regional response plan. That plan is currently only 4% funded. And I've been asked about the situation in El Salvador, and I can tell you that since the beginning of the pandemic, the Secretary General has urged governments to implement emergency measures that are legal, proportionate, necessary, and non-discriminatory, and have a specific focus and duration, and also to take the least intrusive approach to protect public health. Politicizing the work of UN technical agencies would only undermine national efforts to tackle the pandemic. The Secretary General urges all political stakeholders to act responsibly with full respect for human rights, democratic institutions, and the rule of law. The UN stands ready to support Salvadorans in their efforts to build a peaceful, democratic, and prosperous country as they have done since the signing of the peace accords in 1992. That's enough for me. Let's go and take your questions in case there are any. Is Florencia there? Let's see. Benny. Mr. Avni.
Following up on actually Pamela left a note there about the letter President Trump sent this morning to the WHO, specifically about the criticism of the WHO kowtowing to China and the pointed criticism of Dr. Tedros in the letter. And of course, the threat of within 30 days withdrawing all funds to WHO.
Listen, we've seen the letters reported in the press. I can tell you that all of the answers to the questions you've raised are in the remarks the Secretary General delivered yesterday to the World Health Assembly, and I really have nothing to add to that. Go ahead. Benny, for some reason I can't hear you, which is a first. Benny, I can't hear you. Okay. All right, listen, I'll come back to you when you regain your voice, which I no doubt you will. Okay. Pamela asked a question about Tedros, which I felt I've answered. Iftikhar, the UN advisor on genocide prevention, Adama Dieng, issued a statement today voicing concern over India's 2019 Discriminatory Citizenship Act and the continuing hate speech against Indian minorities, especially Muslims. Does the Secretary General plan to take this matter with the Indian leadership? No, we assume that Mr. Dieng has a very important voice within the UN system on these issues, and I have no doubt that he will convey that statement to the Indian authorities. Benny, do you want to see if you found your voice again?
Let's see. Can you hear me?
Yes, now I can see you.
Can you hear me?
I can hear you, the most important.
So yeah, better hear me than see me. So specifically about the question of withdrawing funds, I mean, we have a new situation. There was like suspension of funds, and now there's a threat within 30 days of withdrawing all funds from WHO. No answer on that?
Look, again, I think the Secretary General's views on WHO, on a look back, all of that is in his remarks he delivered yesterday. Abdelhamid.
Thank you, Stéphane. Last Saturday, the non-aligned movement issued a strong statement about the prospect of annexation of Palestinian land. On Sunday, the Israeli government was formed, and Netanyahu gave a speech, and he said we are moving ahead with the annexation and extending Israeli sovereignty over the Palestinian land. The only one who didn't speak out against the annexation is the Secretary General. Can you give me explanation, please?
Again, I think we continue on our parallel path. I think the Secretary General, his representative, Mr. Mladenov, has also has spoken out very clearly and warned against annexation, warned against any unilateral moves that would jeopardize the two-state solution. Benno?
Yes, thank you so much. I'm circling back to Mr. Trump's letter again. So when you point to the remarks of the Secretary General yesterday, I frankly don't understand why, because that can't be the answer to a letter which was published at midnight, I think. Also, did you receive the letter or not?
Well, the letter was not addressed to the Secretary General, right? I mean, it was posted on Twitter. It was not addressed to the Secretary General. It was addressed to the Director General of WHO. So you would have to ask them how they will officially answer the letter. The the issues raised by the President of the United States in his letter, I think if you're asking me for our reaction to it, and I can tell you that all of the issues raised are answered in the Secretary General's own statement yesterday, and his previous statements on WHO. Toby.
Hi there, Steph. Thanks. Just a quick question on Cabo Verde. Is it usual for UN staff to donate their salaries? Any more information on that? Thank you.
No, I mean, we can get you a bit more detail. It's not usual, but we've seen. I mean, it's the first that we flagged it within this context of a country team. But we have staff in New York who have donated goods and services to the pandemic, whether it's to deliver food. So I think it's not uncommon for UN staff to either volunteer or to give back to the communities where they work. But we can get you, Ari in my office can give you a bit more, help you get you a bit more information on Cabo Verde. Okay. Mario.
Hi, Steph. Thank you. Just to follow up on your statement on El Salvador, is the ESG concerned about any particular measure that the government has taken, and does he plan any sort of use of the UN mechanisms as some NGOs have asked him to do? Thank you.
I mean, a lot of this will be taken up. Will be taken up by the by the country team. There have been, there have been some statements made by different entities within the government that have been of concern to us, and that's why we're raising these issues. So I think that's what I have for you on that at this point. Abdelhamid, I wanted to add that Mr. Mladenov is scheduled to brief the council tomorrow, so I'm sure you'll hear back a bit more on that as well. Okay, and so Toby, I think just on UN staff donating. Also, I wanted to. I misspoke in saying this was the first time we'd flagged it from a country team. In fact, if I had listened to what I had said myself yesterday, I would have heard myself say that UN staff members in Kazakhstan have also donated essential COVID supplies, include food and hygiene kits, to a number of families in different regions of Kazakhstan. Gloria had a question about preparations. Are refugees from Myanmar making Bangladesh especially vulnerable? With all the religious convocations going on, are religious leaders pressuring the Buddhist community? I'm not aware. What I can tell you is that we're making the country team, the humanitarian team that we have on the ground in Cox's Bazar, is working hard to do some preventive measures to ensure that the virus does not spread within the refugee community, and of course with the host communities in Bangladesh. All right. Any other questions, Florencia? No. All right. Thank you all, and we'll see you tomorrow.